IUD stands for Intrauterine Device. It is a small T-shaped device that a doctor places inside the uterus to prevent pregnancy. IUDs are a long-term birth control option. They're very effective and can last for several years. There are two main types of IUDs, hormonal and copper. Both types are safe and effective. Your doctor can help you choose the best IUD for you. IUDs offer a convenient and reliable way to prevent pregnancy. They are more than 99% effective. This means that less than 1 out of 100 women using an IUD will get pregnant each year. IUDs provide long-lasting protection. This means you don't have to worry about birth control every day or every time you have sex. Hormonal IUDs are a popular and effective form of long-term birth control. These IUDs work by releasing a small amount of the hormone progestin into the uterus. Progestin thickens the cervical mucus. This makes it difficult for sperm to reach and fertilize an egg. Progestin can also thin the lining of the uterus. This makes it less likely for a fertilized egg to implant. Hormonal IUDs are more than 99% effective at preventing pregnancy. They can last for 3 to 7 years, depending on the brand. Hormonal IUDs offer a convenient and reliable way to prevent pregnancy with long-lasting protection. They are a safe and effective option for many women. Copper IUDs are another safe and effective long-term birth control option. Instead of hormones, they use copper to prevent pregnancy. The copper IUD releases small amounts of copper into the uterus. Copper creates an environment that is toxic to sperm. This prevents sperm from reaching and fertilizing an egg. The copper IUD does not affect ovulation. This means it does not prevent the ovaries from releasing an egg each month. Copper IUDs are more than 99% effective at preventing pregnancy. They can last for up to 10 years. They are a good option for women who cannot or choose not to use hormones. Section 4. Insertion and removal. What to expect. Both hormonal and copper IUDs are inserted into the uterus by a healthcare provider. The procedure is usually quick and simple. It is typically done in a doctor's office. Before insertion, the healthcare provider will examine the patient's pelvis. They may also perform a pap test or other tests. During insertion, the healthcare provider will insert a speculum into the vagina. They will then use a special tool to insert the IUD through the cervix and into the uterus. Most women experience mild cramping during and after insertion. This can be managed with over-the-counter pain relievers. Removal of an IUD is also a simple procedure. The healthcare provider will use forceps to gently pull the IUD strings. This causes the IUD to fold up and be easily removed from the uterus. Section 5. Benefits of IUDs, long-term peace of mind. IUDs offer several benefits over other forms of contraception. One of the main benefits is their long-lasting protection. Hormonal IUDs can last for 3 to 7 years, while copper IUDs can last for up to 10 years. This means that once an IUD is inserted, women can essentially forget about birth control for several years. IUDs are also very effective at preventing pregnancy. They are more than 99% effective, making them one of the most reliable forms of contraception available. Unlike some other forms of contraception, IUDs do not interfere with spontaneity. Once an IUD is in place, there is no need to interrupt sexual activity to take pills or use other methods of birth control. IUDs are also hormone-free, making them a good option for women who cannot or choose not to use hormones.